Hello and welcome to the program today. I'm your host, Neal Howard, here on Health Professional Radio, and I'm in studio with Dr. David Dodick. He's here with us as chair of the American Migraine Foundation and president of the International Headache Society. And he's here to talk with us about a recently announced continued support and partnership with Allergan Incorporated, offering educational grants to young neurologists and research scientists. Welcome to Health Professional Radio, Dr. Dodick.
My pleasure, Neal.
Thanks. Now, you are the chair of the American Migraine Foundation. Give us a little bit of background about how you became chair and also president of the IHS.
Hard work, Neal.
Absolutely, no doubt.
I became president-elect of the International Headache Society about 3.5 years ago. That's a process whereby individuals from around the world are nominated. And then there's a selection process, and then there's a vote by all of the members of the International Society from around the world. So I was fortunate enough to be elected president, and I'm about 1.5 years into a 2-year term right now. As far as the American Migraine Foundation goes, I was formerly the president of the American Headache Society, and during that time we developed the American Migraine Foundation. And once my presidency elapsed from the American Headache Society, I then became chair of the American Migraine Foundation. I've been chair for about 4 years now.
Now, the International Headache Society is in partnership with Allergan Incorporated. Talk about this company and how you all are helping to educate scientists and researchers and young neurologists about headache.
Well, the partnership is actually between the International Headache Society, the American Headache Society, the American Migraine Foundation, which is really a committee of the American Headache Society, and the Canadian Headache Society. And so we developed this International Headache Academy approximately 4 years ago. We held our 4th meeting. Allergan has been the sponsor of this International Headache Academy. So they've provided unrestricted educational funding support to be able to allow us to hold these meetings. So we've held 4 International Headache Academies, which cover North America and South America. And we've also held what we call IHEAD meetings, and those happen in Europe. Very similar, where we identify 50 of the brightest young clinicians and scientists in the field who are going to be the future leaders in this field someday, we believe. And so that was the impetus for developing the program, and the objective is really to identify and then nurture who we believe are going to become the future key opinion leaders and the people who are going to drive the science and the people who are going to establish multidisciplinary comprehensive headache centers that provide care to patients around the world.
What are just a couple of the important criteria to be identified as one of these future game changers?
Well, the criteria really, we want to get to people who are in the late stages of their training in neurology, as well as those people who have identified or expressed an interest in headache medicine by doing a headache fellowship, or they're within 5 years of either their fellowship training or doing their doctoral thesis, PhD. So these are people with already either an expressed intent to focus on headache medicine or already a commitment to focus on headache medicine. They're nominated by identifying, we ask chairs of departments of neurology, as well as program directors of neurology residencies, to identify and nominate an individual who they think will be a future leader. And then we have a committee that vets these proposals and nominations, and then we select approximately 50 of the 50 of the best and brightest in the field. And that's how they're identified. And it's a longitudinal program, so that when we identify these individuals, this isn't just a one-off meeting. This is an opportunity to mentor these people over time. So quite a significant number of the people who participated in the first International Headache Academy also participated in the second, third, and then ultimately the fourth. It allows them the opportunity to establish a network amongst each other and strike collaborations. So they may do research projects together. And it also allows them and gives them the opportunity to establish a relationship and a network with the key opinion leaders or the experts who run this International Headache Academy. So it's really a unique opportunity for them to really establish very important networks within which they can collaborate and do research.
How much patient advocacy is involved in these conferences each year, as far as getting the patients on board with understanding some of the new breakthroughs and some of maybe the new methods of diagnosing headache?
Yeah, good question. So this last meeting we held at UCLA just a few weeks ago, it was the first time we had patient advocates. So they happened to be two of the patient advocates that we have sitting on the American Migraine Foundation board. And they spoke with us for about an hour and a half about their journey, about how it impacted their personal and professional lives, and about how important patient advocacy is both for patients to sort of develop a community and to advocate for themselves and for this disease, as well as developing partnerships with experts. So, a collaboration between patients themselves and the experts to advocate for patients who suffer and for the disease itself, because there's not a lot of patient advocacy that's been done in this field. And we know from other fields like cancer and HIV, where patients coming together in a community to advocate for more education, greater awareness, and funding for research can accomplish amazing things.
Do you find that funding coming from more than just a few sources, maybe from learning institutions, are there any funding avenues from these institutions where these scientists and neurologists are getting their training?
Well, there's a couple of answers to that. First of all, only now are there a growing number of training opportunities for people wanting to do headache medicine. So now we have about 34 accredited fellowship training programs in the United States, for example. When we first started the foundation, there were about 11. So we've come a long way in the past 4 or 5 years. We've more than tripled the number of fellowships. But the funding for research is still a big problem in this field. Federal funding for migraine research and for other headache disorders is about 1/20th of 1% of the federal research budget.
Wow, that's
so despite
nothing.
the fact that migraine, it's nothing, especially when you consider that migraine is the third most common medical disease on the planet and among the top 6 most disabling among women. So we're talking about a disease that affects about 1 billion people around the world. It affects over 39 million Americans. So the disproportionate amount of funding that migraine gets, given the population burden and the suffering and the impact of this disease, is like nothing else in the history of medicine, actually. So, and that's not changed over time. So the amount of funding that this disease receives for research hasn't really changed over the past 25 or 30 years. And so, the American Migraine Foundation is starting a major public awareness campaign that it's going to launch on March 24th. This has been 2 years in the making, to raise awareness, to eliminate the stigma associated with migraine and other headache disorders, and to start to galvanize a community of patients who will advocate for themselves and for the disease, and finally to generate funding for research. So the American Migraine Foundation, the American Headache Society, will hopefully take over some of the responsibility of funding research that's impactful and that has clinical implications for the patients. In other words, research that's going to lead to advances and new treatments for the disease.
Right. Well, I'm certainly glad that you decided to talk with us today, Dr. Dodick.
Oh, it's my pleasure, Neal. Thank you for the opportunity.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. David Dodick, chair of the American Migraine Foundation and president of the International Headache Society. We've been talking about a highly interactive educational program which recently was offered through the Meyer and Renee Luskin Conference Center in Los Angeles at UCLA in conjunction with the International Headache Academy, the American Migraine Foundation, International Headache Society, and Allergan Incorporated. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can listen in on SoundCloud and download, or you can subscribe to this podcast on iTunes.